Okay, so what we're going to show you guys here is a case of one of the many reasons why horse teeth can fracture. It's not always the same cause. There's a lot of things that can cause a tooth to become weak and brittle and break. A lot of times people think it's trauma. That does happen, but it's actually quite rare, like a kick or an injury. It's really actually probably one of the most rare causes of dental fractures. Some people think they chew on rocks, but that's also pretty uncommon. Horses are really sensitive with their muzzle, and they can sift through grain, you know, they can pick out one or two pieces they like and leave the rest. So, you know, you don't see a horse out there just chewing on rocks. I think I've been around horses all my life and a lot of rocks, and I've never really seen a horse spit out a rock. Not to say it can't happen, but that's definitely not one of the reasons why, except maybe in a very, very rare case. But one of the causes that is pretty common and doesn't probably get enough attention is infundibular disease. Horses have a very unique structure on their upper teeth that they don't have in their bottom teeth. Small animals don't have them, we don't have them, and it's called an infundibulum. And it's very common for there to be developmental abnormalities with the infundibulum that predisposes them to fracturing. And fortunately, there's something that we can do to prevent these fractures if we catch the infundibular disease early enough. And again, this is something that's not discussed enough. It's a fantastic procedure that we're going to show you guys. So this horse here is around 13 years old. He had a history of having a broken tooth a year ago that was extracted, and then during a routine visit this year, it was noticed that he was kind of balling up some feet and had another fracture that was found, and he was referred to us. When we did the oral examination, we could see this tooth right here. We can see that it's fractured right down the middle, and there's this big black cavity right here. And so that's a classic fracture from infundibular disease. We'll show you in a minute what some of the other teeth look like there. And what we can do. As far as the extraction goes, we're able to get these teeth out intraorally. They should be fairly straightforward extractions. They shouldn't take more than 10 minutes to 30-40 minutes max to do them intraorally if you have kind of some of the newer techniques and instruments. You don't ever really want to lay a horse down under general anesthesia because it's not necessary, and the complication rate is so high. I understand it still happens because that's how it's being taught in a lot of places, but there are better ways, and they can have devastating consequences to doing it that way. It doesn't matter how bad the tooth is, we can always get them out through the mouth of these upper teeth. So the extraction was fairly straightforward. We kind of cut part of the tooth off and then moved it around and got it out. We've got Dr. Leducer here is currently working on the horse, and he did an extraction earlier. We have Dr. Pimienta from Mexico that's visiting, so you can see, maybe we'll come to the screen here, it's a little bit easier to show. So right here we have a big cavity that he's cleaning out, and we can see that it's completely hollow and full of feed material. The tooth in front of it, if you want to come forward a little bit, that's pretty normal. Now if we go behind there, he had this tooth right here was removed last year, and then now if we go to the other side, we'll show you guys. So there's the blood from the tooth extraction that we just did that was broken, and then here again are more of these big cavities. So now we'll go back to the cavity that he's working on. This tooth right here is at a very, very high risk of fracturing. It's almost certain to fracture. It's just a matter of when. It could be days, weeks, months, unlikely to even last a year or two because the whole middle of the tooth is hollow. There's just a little bit of tooth here, a little bit of tooth here, and a little bit at the bottom. These three spots, that's all that's holding this tooth together. So it's most likely going to fracture. So one of the great things that we can do with these teeth, what he's doing right now is he's cleaning out the inside of the tooth, and then we can fill it with the composite material, and it's a fantastic procedure. There's some of us that have been doing this procedure for 10, 12, 15 years, and there's a really nice paper that was published on it by Chris Pierce out of the UK. There's lots of data on it. I think the evidence is is very strong that this is a fantastic procedure. The cost is much cheaper than doing an extraction. There's virtually no complications to this procedure. There can always be a complication, but there's very little to go wrong with doing it. And it's extraordinarily rare that a tooth would fracture after this. It's always possible, teeth can always break, so there's no guarantees in life, but it's very, very unusual for a filled tooth to fracture. So we don't really need to do a lot of follow-ups on the teeth that we've filled. The horses can typically go back to work the next day. There's no issues as far as that goes. So it's a great procedure. If your horse has infundibular caries that are grade 2+, for sure 3s and 4s are good candidates. It's something to think about. If you have any questions on it, feel free to email us. We're happy to consult and help you guys try and get the best care you can. And yeah, thanks.